Believes that going after such people is, if you like, payback for the ignominy
Hello, good morning, everyone. Hello, good morning.
Hello, good morning.
Great. Welcome you all for today's exclusive webinar. Oh, we want to humbly ask that we give a few minutes to those who still want to join so that we can kickstart.
Hello. 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 Yeah,
Hello.
hello.
Good morning. We are
Hello.
allowing a few minutes to let others join and then we will start the presentation.
Okay then. All right.
So we'll start in the next minute, 10:15. Please, Mr. Augustine, can you kindly unmute yourself?
Okay.
But why is he showing video? And look at where he used to showing us the face. Who asked you to show you your Hello, good morning once again. It's 10:15 and we want to start the presentation. So once again, thank you for joining the presentation. This is Equity Health Insurance. My name is Emmanuel. I'm with the client relations team, and I'll be having this presentation with my colleague Hafsa.
Hello, everyone. My name is Hafsa. I'm also with the client relations team, and I'm doing this presentation with Emmanuel, who has previously introduced himself. So thank you very much for making your time to join us this morning. And I will let Emmanuel go ahead with the presentation. Thank you.
Okay, so this is what we'll be talking about in the meeting. A brief about Equity Health Insurance, the objectives of this meeting, and then we'll go ahead with talking about the value-added service, particularly telemedicine and drug delivery, as well as other benefits that the team offers to you. Then we will give opportunity for questions and answers. So, who is Equity Health Insurance? Equity Health Insurance is a wholly indigenous company established in 2017, and we are the fastest growing health insurance industry currently in the country. So you see that we have over 50 years of combined experience of the staff. What this means is that you are assured of quality healthcare because your healthcare is in the hands of people who have industry experience. So you are not going to be facing issues of people giving you information that are not industry standards. And we're also the quickest claim paying health insurance currently in the country. What this does for you is that there will not be any point where you go to the facility and then they will tell you Equity Health Insurance has not paid, and so they will not give you care. We currently serve more than 100 corporate clients, and which we are very happy to have all of you join the brand. So this is our mission and our vision. Our mission is simply to continuously improve healthcare through our excellent customer-centric services in a cost-effective and timely manner. So what we are doing is that we want to make sure that healthcare is continually improved. So we want to make sure that we improve healthcare drastically through our customer-centric services. And one of the customer-centric things that we do is what we are having right now, to explain to our clients what services we have and how it benefits them. And then this is our vision. Our vision is to be the leading health insurance company to deliver quality health insurance in Ghana and the wider African market. So we have a vision of delivering very quality health insurance in Ghana. And I believe that moving on, you will see that we've won some very good awards in the industry to talk. That shows that we are really in the business of delivering very quality healthcare. And soon you'll be hearing of us entering some other African markets. Okay, so the first thing we want to talk about is the telemedicine. Now, what is telemedicine? We all understand that the world is moving at a very technological pace, and most of the things that we used to do some few years back are done online. For instance, some few years, most of the meetings we attend used to be mostly in-person meetings. But when COVID came, I think most of us we came to understand that we could have meetings via Zoom and other online platforms. So this is also what we are doing with consultation, where you are able to speak to a doctor online. So you are able to talk to a doctor via audio or video, depending on what the circumstance warrants you to do. I must mention that this is not for emergency purposes. In times of emergency, we would humbly mention that you go to the nearest hospital to go and access care. However, if you are in the office and then you have a bit of a challenge and it's not very pressing or an emergency and you want to talk to a doctor, you are able to access our telemedicine platform and then speak to a qualified medical doctor. Now, how does this work? So how it works is that there's, if you look at your card, you see a number at the back of the card for telemedicine. So you are able to call the number or you call the Equity Health Insurance call center. You provide your membership number and then you share the details of your health concern. And then the center, our call center is able to relay that information and transfer your call to a healthcare professional who will then attend to your health concern. So I will humbly plead that before you call for telemedicine, kindly make sure that you have the details such as your membership number, if you want us to deliver drugs, your location, your active call number, so that we are able to, I understand most of us, we have different numbers for WhatsApp and call. If you have to deliver something to you, we are able to call you on that number. So after a doctor has spoken to you, that is a consultation, the doctor is able to assess the condition and provide a medical advice. And in that advice, if it is recommended that you have further tests, we are able to direct you to the nearest facility that is close by to you for this test. And in case you need medication, we are also able to give you a prescription to go to the nearest accredited pharmacy to have your medication from there. In case we have to offer you medicine, we own a pharmaceutical company, and so we are able to also offer you medicine at reduced prices. So we realize that if you go to the retail shops, you are going to have to pay a significant markup. However, with our wholesale pharmaceutical company, you are able to enjoy medication at wholesale prices or discounted prices, which in turn helps you to reduce your usage on the scheme. And so when we have to deliver a medicine to you, we are able to deliver it to you, your office, without you having to pay for delivery fee or without you having to walk through the sun to go and get these medications. So all the process that I summarized, this is just a flow chart to demonstrate it better. So you make a call with to the telemedicine line, then we check if your policy is active, then consultation is booked with the doctor. So the doctor will in turn then call you and then give you that medical advice. After the medical advice is given, in case you need any referral or if you need any medication or any laboratory, we are able to recommend that you go to the nearest place for this service. And we also do telemedicine for lab review. In case you have a lab request and you want to speak to a doctor to review that lab report or the lab request, you are also able to use the same line. You share with us your membership number, you share with us the lab that you want it to be explained to you, and then the doctor is able to connect with you and then review the result or explain what it means to you. After that, in case you need to do additional labs, our doctors are able to recommend to you facilities that are close to you for the labs to be had. Or if you need medications, we are able to give you prescribe to you your medication. You go to the nearest pharmacy to get them, or we send our dispatch to bring you your medications. So what we also do differently is to follow up on our clients who do telemedicine. So usually after 72 hours, the doctor is able to call you and review what we call that a review consultation. So they will speak to you to see how the consultation, the labs, and the medication that we're giving to you are improving your health. In case that it is not, then we are also the doctor is able to advise on ways that it will help you to reduce this medical condition, or if there's the need to give you a dosage, a particular dosage, increase the dosage, reduce it, or maintain the same dosage. We are also able to do that for you. So what are the benefits of this service to you? So what we are trying to achieve is to reduce unnecessary trips to medical facilities. There will not be any instance where you go to a facility and they will say, maybe because this one is a normal headache, they are not going to charge you consultation, or they are not going to charge you anything for coming to the hospital because it's a normal headache. Any issue that you face and you go to the facility, they are going to be charged consultation. And looking at that, you also have to usually leave your office or leave your home, leave your busy schedules, and then go there. So what we are trying to achieve is to reduce these trips to the medical facilities, where you can do this, you can have this call within 5 to 10 minutes and then still get back to your work. We are also able to reduce the usage on the policy, because the charge on the telemedicine is not as the charge you pay at the various facilities if you go for consultation. So that is, it reduces your utilization and it optimizes claim management during the policy year. And so what we also do is that the other benefit it has for you is that we give you appropriate care, because what we are doing is not to talk to just anybody, but we connect you to professionals who have experience in the field. And so they are able to give medical advice in relation to whatever issue you may be facing. The next thing I want to talk about is drug delivery. Okay, so how does the drug delivery work? I had mentioned during the telemedicine presentation that we also have a pharmaceutical company that deals in free drug delivery, where you don't have to pay for the delivery of the medication. So this is how it works. There's also a number for the drug delivery service at the back of the card. You are able to reach out to us via that number, and then you share with us your prescription. You share with us your location. You share with us your active call number. You share with us where you want us to the medication to be delivered to you, and then we will send it to you. Okay, so I want to take the drug delivery service again. So this is how it works. you are able to call us. There's a number dedicated for drug delivery at the back of the card. You are able to call that number. You are able to send a message to that number with your prescription. You send us your location, your active call number, and then we will get the medications and then send it to you. So all you need to do is get us a clear photo of your prescription. I will humbly ask that anytime you want to get medications, we make sure that the prescription we have is valid, meaning that the prescription is stamped, it is signed, has a doctor's name and signature on it. It is from a recognized facility. There are a lot of times where people think they can just request without prescription. Let me humbly mention that this is a highly regulated industry, and so everything we do is regulated. So you cannot get medications without a prescription. You are not able to get medication without a prescription. So let me humbly reiterate that before you reach out to us for medication, you get a valid prescription and your membership card, and then you send it to our drug delivery number. So there's a WhatsApp platform. You are able to send it via WhatsApp to the team, and the team will work on it. If there's any additional information they need, they're able to call you. That's why I mentioned that we also need your active call number so that we can be able to reach you in case we need any more information from whatever prescription you've sent it to us. So the team will process the medication and then send it to you without you having to pay for the delivery of the medication. So how does it benefit you? I had mentioned that we have a wholesale pharmaceutical company. So we give you the medication at a subsidized cost as they are sourced from a wholesale pharmaceutical company. So you don't have to go to the retail. So you don't have to go to a retail that has a higher markup than what you would have gotten from us. And how this also helps you is that because the markup on these prices are not very high, we are able to allow the benefits to last throughout the year. So if you are getting medication that will cost you, let's say 120 on a retail side, you may be getting it around 80 or 100, meaning the remaining 20 or 40 cedis will still be in your benefit that you can use the next time you need any service that the insurance covers for you. And one other benefit that it has for you is it makes getting medication easier because you don't have to leave the comfort of your room and then be roaming about for these medications. So you are able to get medications with minimal effort. It saves you time. It saves you the headache of going from one pharmacy to another. Sometimes there are some medications that they are difficult to come by. You have to be roaming around for these medications. And so this drug delivery service, it helps you and it prevents you from having to go through that stress of moving here and there for the medications. Another thing that we do as a value-added service to make sure that your benefit is able to last with you for the 12 months is call verifications and claim verification. So what we do is that we have a team that calls these facilities, sometimes calls members to verify if the service that they are billing to them are actually true. Because sometimes we get calls that I've not visited this facility and I've received a message that I went to so and so facility and they are billing me this amount. So what we do is that as much as the claim comes in, we call members, sometimes do in-person visit to the facilities to see if they really offer the services that they are charging our clients. And we call members to verify if they are receiving the services that the hospitals are billing on their behalf. We don't want a situation where they bill you X-ray when they have not done any X-ray for you. So these are also things that we do at the claim side to make sure that your policy is enough, the benefit is enough for you throughout the stay. The other thing that you should be happy about is our quality assurance audit that we do for you. What we do for you, there are things that are highly governed by strict quality assurance protocols. So we ensure that if it's medications you need, we are giving you the exact medications that your doctors have prescribed for you. We are delivering exactly what you need for your health condition. We don't want a situation where you will give you something different than what doctors have prescribed for you, whether you did the telemedicine with us or whether you went to see your own doctor. So these are measures we have put in place to make sure that you enjoy the best of service and the quality of service that you need. The last thing I want to talk about is our customer support. In case you don't have any of our numbers, you are able to pick these numbers for our call center numbers. The drug delivery that I mentioned, the number is displayed on the screen. In case you don't have it, you may want to save it so that when you need medications, you can reach out to us on WhatsApp to this particular number. The telemedicine that I also mentioned, I have the number here as 0503860381. So my colleague is putting the numbers in the chat. Whoever needs to access any of these services, whether drug delivery or whether telemedicine, kindly reach out to us via these numbers, and the team is always available to assist you. As I mentioned earlier on, the call center numbers are also at the top. You are able to call us in case you have any challenge. Let me humbly mention that in case you go to any facility and then there's a challenge with any service that you want to, maybe they are telling you they don't take equity, but we have also told you that we work with them. Maybe they are telling you this service is not covered. We will humbly plead that you call us whilst you are there so that we can speak to the facility and make sure this, whatever issue it is resolved whilst you are there. You don't want a situation where you have to pay out of pocket, or we don't have a situation where you have to be returned home because you do not have enough cash on you to access whatever service you went there to access. This is healthcare, and so we want to do this. We don't want to leave room for any error because we understand that healthcare is a very critical area, and then we are all in with you. So I will humbly plead, in case you go to the facility and there's any challenge at all, kindly do not hesitate to reach out to us. Thank you very much. So this brings me to the end of the presentation. In case you have any questions, our team is available to take them. You may also subscribe to our social media handles. Facebook, we are on Facebook, we are on X, previously Twitter, we are on Instagram, and we are on LinkedIn as well. Thank you for your audience. We are available for your questions.
Thank you, Emmanuel, for the insightful presentation. Also, kindly note that these social media handles have been posted. You just don't follow us for follow's sake. You follow us to get insights on your health. So we do post health tips over there. We do also have a WhatsApp channel that you can join that can get health tips for you once in a while so that you can maintain your health as you are with us. Kindly put your questions in the chat box, or you can raise your hand and then we can answer your questions, please.
Hello, good morning. My name is Keksi Jamepe. I work closely with the team. Mr. Size, I would want to humbly ask, you mentioned that when you go to facilities, you are able to get some feedback as if they don't like, as if to say they don't like equity. So would want to ask, what was the situation so we can be able to help resolve it for you? And also if there's a need for us to engage them, please help with clarity so we can help.
Can you hear me? Hello?
Yes, Mr. Sai, kindly go ahead.
Okay, it's not just one facility. I know anytime I visit most of these health facilities, and then you mentioned the equity as your insurance, they usually give a negative feedback. And though maybe when they are trying to make claims, they go through a lot of stress and all that. So I don't know why that is though. So maybe if you have any cumbersome processes that the facilities need to go through, maybe you might have to reconsider those processes, because usually equity has, let me say, quite a negative impression out there. If you can look into that, that would be useful.
Very well. Thank you very well, Mr. Sai. I must thank you for bringing this up. What we are looking at is the engagement. So just yesterday, Wednesday, we had a session with some of the service providers. I must mention that there are certain interventions we've done to protect the client. So let me give you an example. You go to a facility and it takes them a week to enter your claims. We are saying that it is not prudent, it is not helpful, because by the time you leave the facility, you do not know whatever they may enter as your claim. So the OTP, for example, came in to help us do real-time entries. Why should the hospital wait 2 weeks, 1 week before they enter a claim that you had done, let's say in August? So these are all coming in, but you know, change is quite difficult to accept sometimes. So they are hesitant to say that we are not helping them. I know our HSP team is on the line, and they will tell you that some of these things are not to frustrate the client, but rather to protect the client and also make sure that the facilities do the right thing. There are certain guidelines we give them. If you allow them, a facility just charges your client anyhow and comes to claim for it. If we are not mindful, your benefit will be exhausted within the shortest possible time. I would want to ask the HSP head, Isaac, please, if you are in, this is what is coming on, that it seems the facilities are giving a lot of negative feedback on us. If you can address it for Mr. Sai. Thank you.
That's what.
Hello.
Yeah, hello, Keksi. It's well noted.
Yeah.
We would add it to our schedule and then continue to engage the service provided as such. So we'll be grateful if you can get the name of the facility, then we can tackle up from there. Thank you.
All right. Since Mr. Sai, you can help us.
Yes, so it's not a specific facility. You know, I've been to a few facilities that there was no one that had not raised eyebrows when I mentioned your name.
Please,
So
which facility?
I cannot pinpoint to one facility. That, like I said, I've been to a number of facilities that anytime I mention your name, there is eyebrows. So it's not as if there is this specific facility who doesn't like you. So to all the facilities I have been to, almost all of them, they raise negative comments. So I don't know why, like I said, but as you mentioned, this is to protect the client's interest and all that. So I understand you to some extent, though, but again, like you said, it would be better if you also still continue engaging with your service providers so that they do what is best. So nobody would be assuming that you are the ones who are not putting up your best. You get it? Yeah. So I understand it. I can't pinpoint one facility for you, actually.
Thank you, Mr. Sai. We'll do well to engage you further to see how best we can be able to engage some of these facilities. Thank you for the feedback.
That's fine. That's fine.
Thank you, Mr. Sai. I see some questions in the chat box. Nachim, okay, is asking whether they can register your children who are in the university but are more than 18 years old. Yes, please, you can. We do have family packages as well that can register you and your family under one policy so that you can enjoy these benefits as well. However, certain companies like to add beneficiaries to their policy here. So they can buy health insurance for the employee and his or her beneficiaries. So yes, we do cover for that. I also see a question about pregnant women being covered. And that's from Tongo Daniel. Can pregnant women also benefit from this policy? Yes, they can. We do have maternity benefits for every plan that we have, and also for the family packages as well. So they are not left out, please. I also see a question from Mabena. Do you compare the bills that comes in from the facility so they don't double bill the client? Yes, we do. That's basically what our claims department does. So we mentioned earlier that we do quality assurance as well as the claims vetting. So we vet every claims that the facility brings to us, and then we make sure that they don't double bill our clients to frustrate them in any kind of way. So yes, we do. Okay, so I'm also seeing a question about the OTP verification code that you usually get when you visit the facility. I'm so sorry. Let me apologize for you receiving the OTP code late. Sometimes it depends on the network that is being used to share the OTP code. However, if you're having any problems with retrieving the OTP code whilst you are there, kindly call us whilst you are there. Do not leave before you call us for the OTP. You can call us and then we can give you the OTP code for you to go ahead to get your service done. Okay, so I'm also seeing something here. From Nanaisi, kindly clarify if the hospital should request for the OTP twice. Usually they ask for it once I get to the hospital and then a day or two after the attendance, sorry. So this is basically when they are entering the claim to submit to Equity Health Insurance. They need the code to be able to submit the claim on your behalf. That's how come they would call you and ask for the OTP to be able to enter the claim for your service that day. So yes, sometimes we do that. I also see a question from Mabena again. Antenatal visits charged each visit or one-time registration? Antenatal visits are charged per every visit. So every visit that you go to the hospital, it will be covered for you per visit.
Yeah, so everything you see after her visit. All information can be Hello, I would want to ask if there are no further questions, we'll wrap up this session. Yes, Jacob, do you have a question for us, please?
Yes, please. I put a question there. I don't know whether it's my network. I was not hearing you for a while.
Okay, you can come in, please.
Yeah, I'd wanted to find out. I realized that the cards expires frequently. For instance, those that we have now, it's expiring September. Let me see, that expired September 23rd, and we've not received new cards yet. I'm wondering why we cannot do an annual one, since the renewal can still be on the short terms, and that is done in finance, or let me say, it's an office work that has been done that we need to pay to renew, not necessarily changing the card every 3 or 4 months or 6 months, because changing the card will also bring a cost. It comes as a cost. So why do we have to incur that cost? If the numbers are getting high, it means that we'll be incurring the cost of the card. So why don't we do an annual one, or maybe, and then they just get renewed by paying for the renewal?
Very well, Jacob. Please, which company are you with?
And sorry, I'm with Ghana Limited.
Great. So all your cards are annual. So it is from this September to next year. So for example, it will start from 24th September to 23rd September. So next year. So all the plans are for 12 months. So we do not renew on, let's say, monthly or quarterly or biannual basis. It is solely 1 year. Some institutions even have 2 years. In your case, I think the process has been done. So we would be working on the cards for you within the shortest possible time. So normally the renewal process, we need to receive a list. We action that list, validate it. Your HR team confirms it. Then we begin the card printing. So normally maybe it had delayed because we don't want to do it in piecemeal. We want to print all the cards, deliver to your team, then they'll begin to share with you. So your plan is a 1 year renewable contract. So that's it. Thank you. Hello, Jacob. Did you hear us clearly? Okay. So before I leave it to Yima to close it up, I would want to say that if you use or take advantage of the telemedicine, you take advantage of the drug delivery, your utilization is going to be very good. What it means is that the benefit is there to support you when you actually need it. So if it is not an emergency, you don't need to rush to the hospital, so you get charged. for consultation. You can equally speak to top rated doctors on the telemedicine platform. If it is medication, you can equally order. Once you don't get it from the in-house dispensary from your hospital, you can be able to let us know. The team would support you with it. Emmanuel, over to you, please. All right, team. I would, on behalf of the Equity Health team, I would want to say thank you for everyone for making time. We know Fridays are busy for you, but we've had a very good conversation, and we appreciate your time, your questions, and the feedback to improve the service delivery. As my colleague Emmanuel mentioned, we would want you at every point to call and engage us. When you are at the facility and there's a challenge, call us. If you are at the pharmacy and there's a challenge, call us. If you are reaching out to make a complaint or a suggestion, call us. There are about 4 or 5 lines on the back of your card. Anytime we are available to support you. Do always remember that Equity Health is here for you. Thank you very much, and have a very restful and a lovely weekend. Thank you. Hello, Doreen. We are saying that you can reach your HR to help you get the card, please.
Hello.
Hello, hello, Doreen. We can hear you, please.
Please come again. Hello.
Hello, Doreen. We are saying that kindly reach out to your HR. They would be able to help you get your card, please.
Okay.
Thank you.
Okay. You're welcome, madam. God bless you. Bye.
Bye-bye. Enjoy the weekend.
Same to you.
Goodbye, everyone.
Okay.